Hi, I'm Brigitte Harbers. I'm a member of the class of 2022. I'm a molecular biology major, and I'm also getting a certificate in global health and health policy.
Hi, my name is Maddie Winter, and I am also a member of the class of 2022. And I am a history major, and I'm also getting a certificate in global health and health policy. So, first off the start, this is our presentation called Containing COVID-19, Evaluating New York City Public Hospitals Screening and Isolation Procedures for Potential COVID-19 Patients. So this summer, we had an 8-week internship with NYC Health and Hospitals Special Pathogen Program, which was also in the midst of the COVID-19 pandemic in New York City. And so just to give some background, New York City Health and Hospitals is one of the largest public healthcare networks in the country, and New York City Public Hospitals also has about 11 hospitals within all areas of the city, and also 7 ambulatory care centers, so which are like outpatient clinics or including primary care offices. And also just to note, a lot of these hospitals and facilities serve low-income and racial minority communities who were disproportionately afflicted by the coronavirus during the pandemic. So the Special Pathogens Program oversees response to infectious diseases and special pathogens throughout the system, so throughout all of the facilities in the New York City Health and Hospital Network. And in the past, they've worked on things like Ebola, measles, seasonal influenza, and currently they're helping to coordinate the response to COVID-19 among the network.
So a big part of our internship was making sure that we had an objective, and this objective for our internship was to, get firsthand experience in analyzing and developing public health policy, and especially focusing on how to effectively identify, isolate, and manage infectious disease and special pathogen patients. And because this was a global health and health policy internship, we really wanted to focus on gaining that first-hand experience and understanding what it meant to develop public health policy. And this was kind of our first-hand experience at doing that in our first time. So it was very exciting because we have to see it kind of from the start to finish process of what it means to really be a part of developing policy for public health purposes. We also had the opportunity to get directly involved in addressing a current pandemic, which is obviously something that not very many people get to experience. And for both Maddie and I, as it is within our interests of academic study, it was really perfect for us to get a better idea about what this actually means regarding applying what we're studying, when applying what we're learning to our experience. So this also really included, conducting data analysis and developing recommendations based on what we found through our analysis.
Okay, so to move on here, we're going to talk about our main project this summer, which was focusing on analyzing data from secret shopper drills. So just to give some background, throughout the summer, New York City Health and Hospitals employees conducted secret shopper drills at 11 of all 11 hospitals in the New York City Health and Hospitals network. And so basically the secret shopper drill consists of someone entering an ER who's kind of undercover as an employee feigning COVID symptoms. So in this scenario, they complained of a cough, fever, and some sore throat, and would enter an ER, and also reporting domestic travel. And so when inside the ER, the secret shopper individual would then document all of the infection control measures in place in the ER, both at entrance to the facility, in registration and the triage process, in the waiting rooms. Some examples of that would be were there temperature checks at the entrance to the facility, was there social distancing in the waiting area, what questions were asked at registration for COVID-19 screening, how many hand sanitizing stations were there, and also questions would document metrics about the isolation process. So talking about what kind of room they were placed in for isolation and what kind of PPE the healthcare worker was wearing in that scenario. So that's kind of basically background about the drills.
Within those drills, obviously, we had our own roles, and our direct roles as interns was to determine the data points of what should be recorded during the drills. So for example, we had kind of 3 different sections: the entry, screening, and isolation. So it'd be like, time to isolation, like what it was like for getting screening done. So if people asked you, hey, have you been traveling recently? Have you been experiencing these symptoms? Also like looking at what was held in the waiting room regarding like social distancing decals, if there was hand sanitizing stations, if their seats in the waiting room were spread out for social distancing purposes. So as interns, we developed what kind of data points the people running the drills would be collecting when they went to the facilities. We then analyzed the data from these drills and we recorded the trends observed throughout all 11 facilities. And then based on these findings, we were able to determine the strengths and weaknesses for all the facilities, specifically based on whether or not they were able to identify and isolate COVID-19 patients. We ended up being able to develop an after action report that was facility specific and system wide with recommendations to improve a facility's capability and successfully be able to effectively screen for and isolate potential cases of COVID-19. We took that AAR report as well as PowerPoints that we made, and we were part of calls that our supervisors held with these different facility managers to make sure that they understood why we were telling them such kind of recommendations or what areas of improvement they had, to better prepare the facilities for, you know, a potential second wave that may be coming for COVID. So this is all about really, you know, communicating effectively to these different facilities what they are currently doing and what they can be doing better. Below you can see, additionally, just to make a clear note, because a lot of this material was developed internally through the system, we are unable to publish any specific recommendations or any specific kind of data points based on the facilities, but we were able to discuss kind of the overall general idea of what we recommend and what we would kind of analyzing. You can also see, and Maddie will describe kind of the different photos that we've included here as well.
Yeah, and just to note here, kind of we talked about some of the data points that were recorded in this drill. So the lefternmost picture here is a signage that was pretty popular at a lot of the emergency rooms. It's a signage about infectious disease, kind of noting certain symptoms like cough, fever, rash, to take a mask, report any recent travel history, wash your hands often, and also kind of encouraging people to report those immediately to staff, which is very important, especially in the time of COVID. We really want people who are potentially COVID symptomatic to report those symptoms immediately to staff to make sure to limit contact with other patients. So signage, main point here being signage was a main point considered in the drills, and different types of signage were evaluated in the drills. Also, the centermost photo is kind of an example of what a socially distant waiting room would look like. So that's a photo that one of the employees took at one of the waiting rooms, kind of noting there, it's a little difficult to see, but there are signs on the seats that mark to not sit there, so you can enforce social distancing. So seating would be 6 feet apart for all individuals. And on the rightmost photo is a screenshot of the front page of our after action report. And as Brigitte said, we can't share any specific details or specific data of performance at the facilities or specific kind of numbers evaluating the strengths and weaknesses, but we can present the kind of general proposed recommendations that the interns created based on the data from these secret shopper drills. So to start off, one of the main sections of the drills was screening. So that was kind of talking about from entrance to the facility through registration and triage process. So here are the kind of 5 general or big recommendations that we developed according to screening. So the first one is that all visitors and patients should undergo temperature and symptom screening at entrance to the facility and also be asked to sanitize hands, which is kind of important already for identifying people who are potentially COVID-19 symptomatic or another disease symptomatic, and also kind of helping to limit and control the spread of infection. The second one is that facilities should have masks visibly available in the waiting area or have clear signage placed, kind of directing patients to get to the front desk to get a mask if needed. Our third recommendation was that social distancing floor decals should be placed in the emergency department waiting area, which are kind of stickers on the floor that mark to stand 6 feet apart from each other, which are especially helpful in enforcing social distancing. And all seats in the waiting area should be appropriately socially distanced, making sure there's clear signage or they're taped off to make sure there's at least 6 feet apart. And 5, kind of a big point was signage. and that signage should be visibly and strategically placed. So things like being placed at eye level or being large so people can really visibly and it's explicitly visible. So the message is clearly communicated. And kind of some of the types of signage that we were recommending is signage mandating face coverings for all patients and visitors. So anybody entering the facility should be wearing a face covering, and also having visible signage informing about COVID-19 symptoms or recent travel history, informing that people with COVID-19 symptoms and recent travel history should immediately report that to staff. So kind of the second area of the drills, or the second objective, was isolation and infection control. So the recommendations that we developed for that section of the drill was that patients reporting COVID-19 symptoms should have an expedited registration process, meaning that they're either separated from other patients or they're brought immediately to triage, but basically just a process that tries to limit contact with other patients. So if someone isn't waiting in the waiting room for an extended periods of time with a large group of people. And so our second recommendation was that all suspected COVID-19 patients should be placed in a negative pressure isolation room. And if a negative pressure isolation room was available, that suspected patient should be placed in a private room with a closed door. And similarly, kind of based on that, is that another recommendation we made that was that all rooms that have a suspected COVID-19 patient, whether it be a negative pressure isolation room or a private room with a closed door, should have appropriate infection control signage on the front. So all healthcare workers know that there's a suspected COVID-19 patient in there, and kind of infection control signage can include things like proper donning and doffing of PPE, hand hygiene materials, and other just general information that there's someone with a suspected COVID-19 infection there. And kind of one of our final recommendations was that all healthcare workers who are entering the room with a suspected COVID-19 patient should be wearing appropriate PPE. And kind of what we're defining as appropriate PPE in this recommendation is a gown, gloves, a surgical or N95 mask, as well as eye protections. And just to kind of reiterate here, these are a lot of general recommendations, and it's to make it clear in our presentation, the fact that we made these recommendations are just general things that should be done. It did not necessarily mean that a facility did not do any of these things, right? Just to make that clear there. So it's just things that generally should either be continued to be done in a facility or should be kind of improved on if that wasn't there. And that would have been something specific in the report, but cannot be published for our purposes here. So what we provide are just kind of the general recommendations for people to keep doing or kind of work on building towards. So almost a kind of recommended practices.
Exactly. And, just as Maddie said, a lot of these drills are like what are really important to the special pathogens program, because it is within creating these general recommendations that we get a better idea about what the facilities should be having and, like, in general, what we should be looking for to better prepare for epidemics, pandemics, or in general illnesses that are very contagious or could be, seen throughout a lot of people. And when entering an emergency room, it's always good to be able to make sure that every emergency room and all the staff are well aware this is what is expected of them. And in conclusion, to discuss the secret shopper drills, these are really important because they accurately capture healthcare facilities' readiness and capabilities to identify and isolate special pathogen patients. Although all these facilities do send in a safety and health plan, obviously it's always good to make sure you can go in and make sure that health and safety plan is actually in place and is something that all staff members and this facility itself is following. This is just to make sure, during the busiest times, it's still running flawlessly and we can best expect these facilities to uphold what we believe is preparedness and responsiveness to special pathogens and to COVID. And additionally, these drills really reveal the strengths and the weaknesses and, the areas of improvement for a facility and their current preparedness, which then we are able to use to create these general recommendations or facility specific recommendations as well, which is really crucial to making sure that the whole system wide of facilities is effectively combating COVID-19 amongst other infectious diseases. And then lastly, the New York City Health and Hospital System-wide Special Pathogens team is currently working with each facility to implement these needed changes. So not only do we provide recommendations and kind of discussions about what should be improved, we also work with them to make sure they can make these changes because it is really a system-wide effort. And these special pathogen teams and the drills make sure that they can go in and then actually provide the facilities with these changes, and how to work with them to make sure that they can make these changes and not feel like they're just being told to do something and not finding any support. So overall, the system is really being enabled to effectively identify and isolate potential COVID-19 patients and contain COVID-19 in New York City. And of course, we're all worried about a second wave of COVID-19 hitting this fall. So something like these drills and the work that we did with the after action report and creating these recommendations and really analyzing this data is crucial to making sure that we're able to contain COVID-19 to not be as large of a spread or as large of a devastating effect as it has been in the past.
Yeah, thank you so much, Brigitte. I definitely kind of agree with that, of the significance of these drills. So just to cap off our presentation here, we want to just give some acknowledgement. So first of all, we want to thank our supervisors, Dr. Saira Madad and Priya Daggett, the Senior and Assistant Director of the System-Wide Special Pathogens Program at New York City Health and Hospitals, for all their support and mentorship this summer and their constant communication and kind of inspiring us in the field of public health. Additionally, we also want to thank all the other people that we work with at NYC H&H, including people on the emergency management team, the healthcare workers who ran these drills, the employees who participated in these drills, and kind of a lot of people in the system. And additionally, our fellow intern, Kaylee LaMarche, who worked on a lot of these materials with us, we extend a lot of thanks to her for helping us out there. And also we extend our acknowledgement to the Center for Health and Wellbeing and the Global Health Program, especially the Internship in Global Health program, for their support this summer administratively and financially. So thank you so much for listening to our virtual poster session. Thank you.
Yeah, thank you so much. We can't express how grateful we are to have had this opportunity.